जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर शिवासादि श्री गौर भक्तवृंद हरे कृष्ण 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 हरे 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 राम 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 Hello.
Yes.
Can you hear me?
Yes, I can hear.
Okay.
Talk about thyroid hormone metabolism. I'm asking. This question didn't there. Talk about thyroid hormone metabolism, deiodination, conjugation, excretion. That's another question that other than stages of thyroid hormone production. Deiodination by deiodine. Enzyme removes iodine atom from T4 to 3 or inactive form. Conjugation T3 or T4 can be conjugated with glucuronic acid or sulfate, making them water soluble for excretion as bile. Excretion conjugated thyroid hormone are primarily excreted in the bile and feces. Okay. What will start and or bile or lower limb?
I don't know why it is happening. My this Word file becoming very slow to open. You can see the screen.
No.
upper limb, thorax, spine, lower limb, head and neck, abdomen. Asma is joining. I'm planning to open my files. Hello.
Hello.
Yeah, hi Asma, how are you?
Fine. ازيك يا اسماء؟ ازيك يا اسراء؟ كويس.
Upper limb, thorax, spine, lower limb, head and neck, and abdomen. Can see the screen now?
No.
This PC became very slow. I'm sorry. Now can see?
Yes.
It's moving. Okay, you can see on the screen now. screen can see?
We can see.
Okay, very rapidly we will go through the picture which is relevant and which is necessary. Then we will go to uh, question answer. Now this picture we have seen more or less. We have idea. Main what we need to know from here. Okay, see from the top. This 25 here it is parotid gland. 30, I think here this 30 is sternocleidomastoid. This one great auricular nerve and great auricular nerve. 33 submandibular gland. This is hyoid bone. Only what is written here in the yellow color, that one will read. Submandibular gland. This is hyoid bone. Then this is thyroid, and oblique line of the thyroid cartilage. Sternothyroid. Okay, sternothyroid, and this. Here this red dot. Number 13 is great auricular nerve. 13 is great auricular nerve. Then number 15, you both also can participate and can speak. Okay. So 24, where is 24? 24 is oblique line of the thyroid cartilage. 24 oblique line of the thyroid cartilage. Okay. Then 31 sternohyoid. 31 sternohyoid. 32 sternothyroid. 32 sternothyroid. 33 submandibular gland. 34 superior belly of omohyoid. Superior belly of omohyoid. 38 thyroid. 38 thyroid. Okay, this picture done. In this picture, only the red dot. We'll see only the red dot. Here, what we have, number 1 accessory. Number 1 accessory nerve. Number 1 is accessory. Where is number 1? This is number 1 accessory nerve. Number 1 accessory. Accessory nerve. Number 11 external carotid artery. Number 11, this is external carotid artery. Number 1 accessory nerve. 11 external carotid artery. 16 great auricular nerve. This is number 16. 16 is great auricular nerve. Then 18 hyoid bone. This is hyoid bone. 19 hypoglossal nerve. 19 hypoglossal nerve. Here also we have 19 hypoglossal nerve. This side also another 19. Here also I think there was 19 hypoglossal nerve. Anyway, this 19 is hypoglossal nerve. 21 inferior belly of omohyoid. 21, this is inferior belly of omohyoid. 21 inferior belly of omohyoid. Anyone can ask the number, then it will be easy.
How will we will know that right or wrong?
Here written. You are not able to see the screen.
Okay, but if I ask how to, it will take much time. 65.
No. Only you will ask the red dot. You can see
Red or yellow?
here in the name where it is written. You can see here 37, 43, this 60 and 61, then 54. Here 6.
Only
Only this
red?
only red dot.
But as 27, it's not in red, but I think it's important. 27. What's this?
Yeah, 27 is lingual nerve.
Yes, and it is not in red.
So if you think anything is important, you can ask.
11?
Hmm?
11?
11 is 11. Here also you can see external. Sorry.
Okay. 16?
16 is greater auricular nerve.
18?
18 is hyoid bone.
19?
19 here 19. Hypoglossal nerve. Here also we have 19. This is hypoglossal nerve.
21?
21. We need to find 21. Maybe inferior belly of, yes, 21 inferior belly of homohyoid. Asma, you can also answer.
Okay.
Same time together we will answer. She will tell the number. We will answer.
37?
37. Where is 37? 37. I cannot see.
I cannot see too.
Where is 37?
Posterior belly of digestive. You can see.
Yes,
Posterior belly of digestive. Yeah, this one posterior belly of digestive. Okay.
43?
43. I think it is trapezius. Sternocleidomastoid here.
54?
54 will be inferior superior belly of homohyoid.
60?
61. 60. 60 it is something thyroid cartilage maybe. 60 thyroid membrane. 60 thyroid membrane. 60 thyroid membrane. Okay.
Thyrohyoid.
Thyrohyoid. Okay. Thyrohyoid membrane. Thyrohyoid membrane. Okay. Thyrohyoid membrane. Next.
56.
56. This is 56. Superior thyroid artery.
Is 63.
63. 56 here. Here 56. Superior thyroid artery. Then 63. Where is 63? 63. This is a nerve, just external to. It should be right vagus. 63.
What?
Vagus.
Where?
Just next to the carotid, so it should be vagus.
Yeah, right. Okay. 58.
58. I cannot see 58. Where is 58? 57, 56, 58. 58. It is a masseter muscle. Is it? I'm not sure.
No, masseter, not here.
Masseter temporalis or 58?
Yeah, temporalis.
58 temporalis. Okay, 58 temporalis. Okay, temporalis. Huh?
Should be above, a little above.
Yeah, I was also expecting to, but it is okay because here with the temporal bone, maybe with the mandible, this part is 38. I think mandible. And there it is attached. Okay. 58 is 58 is temporalis. Okay. Then
13.
30.
13.
13. 1 3. 13. 13.
Facial,
13.
facial arch.
Where 13?
Yes, yes,
13 is
right.
13 is facial artery.
Yeah.
Ah, yes, facial artery. Facial artery. Okay.
22.
22.
22. Okay. 22. This is a muscle. Uh,
Where is it?
22. It is below the sternocleidomastoid. Maybe it is
That's not muscle.
22.
It's not muscle.
Okay, it is lateral to carotid, so it is external jugular vein.
Internal jugular vein.
Internal, yes, internal jugular vein. Internal jugular vein. Internal jugular vein. Internal jugular vein. Okay. Okay.
I think it's okay.
It's okay for
If
this.
you want to
No, for this
ask for
picture, okay.
grab muscle,
Here is the full picture. Okay, okay, okay. So anterior triangle of the neck, it is called digestive triangle. We know the boundary and the content, mainly content. Anterior triangle, what are the content? We have submandibular gland, submandibular node, and submandibular gland, submandibular node, and submandibular ganglion also, I think, and facial vessel, hypoglossal nerve. Posterior triangle. Here nerve we need to know. Posterior triangle, what are the nerve we have? We have AP, BP, CP. AP, BP, CP. AP is accessory nerve. P is phrenic nerve. B is brachial plexus. Upper three trunk. BP3 means upper three trunk of the brachial plexus. And CP is the cervical plexus. Cervical plexus, which one? GST. GST. Greater auricular nerve, then supraclavicular nerve, and transverse cervical nerve. Greater auricular nerve, superior cervical nerve, sorry, greater auricular nerve, supraclavicular nerve, and transverse cervical nerve, and also lesser occipital nerve. GSTL. Okay. And which vessel? Third part of the subclavian artery and external jugular vein. External jugular vein. External carotid artery. External carotid artery branches. What are the branches? External carotid artery, 3 in the front. Which one is superior thyroid, lingual, and facial. Superior thyroid, lingual, and facial. This one, I think it will be which one? This one will be facial, right? Because anterior to masseter and at the inferior border of the mandible, where we can palpate the facial artery. This is the facial, and it is coming from the external carotid anterior, I mean front branch. So front we have superior thyroid. This is superior thyroid artery, then facial artery and lingual artery.
lingual.
Lingual going little down. Lingual going little down. Little down.
Yes.
I thought my concept was opposite. My concept was facial will be down because it is coming to the face, and lingual will be little up because to reach the tongue. But it is opposite actually. Lingual coming first, then facial. Maybe in that sense because parotid also little up. Okay. So these are the front branch: superior thyroid, lingual, and facial. and two behind. One is occipital. This is occipital artery and posterior auricular artery. Occipital artery, posterior auricular artery, and deep is ascending pharyngeal. And what are the terminal branches? Terminal branches or terminal branch, maxillary artery and superficial temporal. Maxillary artery, and superficial temporal artery. So, Asma, can you tell what are the branches of external carotid artery?
Okay, we have in the front the lingual, facial, and superior artery. In the back, we have occipital artery and posterior auricular. And we have a deep branch ascending pharyngeal, and two terminal branch, maxillary and superficial temporal.
Okay. Carotid body and sinus. Carotid body posterior to the bifurcation of the common carotid artery, and it contains chemoreceptor. So sensitive to change in the pH, so it controls respiration. And carotid sinus, it is in the root of the internal carotid artery, and it contains baroreceptor, so it controls maintain blood pressure. This is common carotid, and this is the bifurcation. Just posterior to bifurcation will be carotid body, and in the root of the internal carotid artery will be the carotid sinus. This is body. Body contains chemoreceptor, and it is sensitive to change in pH, so ultimately it regulates respiration. And carotid sinus, it contains baroreceptor, and it controls BP. And other nerves, this is glossopharyngeal, superior cervical ganglion, no need. Now thyroid. This number 9 is important. What is structure number 9? Structure number 9. Structure number 9.
Where is this one?
Here.
Number 9? Thyroid cartilage.
No. It is a vessel. Next question will be, what is this structure number 9? This is internal carotid artery. And what is the nerve lateral to it? Hypoglossal.
9 external carotid artery.
External
or internal? Internal carotid artery. 9 is internal carotid artery. Internal. And the vessel, the nerve.
No, external.
Don't say.
I am opening the other file, the origin file.
Okay, open and confirm.
It's external carotid artery.
So I told the correct thing first.
No, you said internal.
Asma, I told external first, right?
You said external, then you said internal.
She said
no, external.
Okay. Final is, it is external carotid artery, right? External carotid artery. And which nerve related to it? Hypoglossal. And what will be the consequence of hypoglossal injury? We know in the tongue problem. Okay, thyroid gland, artery supply, we know this thing. Okay.
In this picture, the internal is not seen, right? You cannot see the internal carotid here.
Internal. This is
Yellow.
this is external. Why? We can see the branches of the external jugular. See, it goes up, then it gives a branch like this.
Okay.
29 is okay. Here you can ask Esra.
Okay.
Only the red dot. And if you think anything important, that one also.
As 5.
Number 5. Where is 5? 5 is here. This is 5. 5 is like coronal suture. Coronal suture.
27.
27.
27.
27.
Where is 27?
Where is 27? 29 or?
No, 27. See figure A on page 5.
Huh?
Yes. It's not in this picture.
Very good. This is pituitary fossa in this picture. Okay, here down. This 27 is pituitary fossa. Okay.
Where?
Down. Next, down picture. On the screen you can see.
X-ray.
Okay. Mm-hmm. Okay. 32.
Is styloid process here.
Yes. 29.
29 is terion.
16.
16. 16.
Where's 16?
The orbital fossa.
Here 16. 16 is orbital here in the color picture. 16 is
parts of mandible. You can see. You can
God.
say 4.
Number 4 is stylomastoid junction.
4.
Mandibular joint.
No part of mandible, not the joint.
Okay. Condyle of the mandible.
6.
6 is coronoid process of mandible.
30.
This 30. Ramus of
30.
mandible.
Good. 3.
Oh my God. Esra, ask mainly this point.
Yes,
You started mandible studying. No, not now, not this time.
Okay. All red points.
All red point. Mainly red point. Mainly red point.
Yes.
Mainly red point.
Okay.
Finish this
Next.
picture. Anything? No. Okay, then next. This picture. Ethmoid ear cell. is number 4.
Hmm?
They are asking about number 4, ethmoid air cell. Where is ethmoid air cell?
No, only this 4. Okay.
So ethmoid air cell. This is ethmoid air cell.
Hmm.
Ethmoid air cell. Okay. Ethmoid air cell number 4. Ethmoid air cell number 4. Foramina. Just we will have a very rapid look. Foramen ovale. Foramen ovale.
Foramen ovale contains.
This is my chart. I like this one. Foramen ovale. Foramen ovale. Otic ganglion. Mandibular division of the trigeminal nerve. Accessory meningeal artery. Laser petrosal nerve and emissary vein. Then foramen spinosum. MMA. MMN. Middle meningeal artery. Meningeal branch of the mandibular nerve. Meningeal artery. Meningeal branch of the mandibular nerve. Foramen rotundum maxillary nerve. Foramen rotundum maxillary. Rotundum maxillary. Foramen rotundum maxillary nerve. Then foramen lacerum. Foramen lacerum. Nerve to pterygoid canal and artery to pterygoid canal. And internal carotid artery pass over it but does not traverse through it. Then optic canal, optic nerve with 3 layers of the dura, and ophthalmic artery and sympathetic nerve. OOS. Optic canal, optic nerve with 3 layers of the dura and ophthalmic artery. Then superior orbital fissure. Frontal lacrimal and nasociliary. Frontal lacrimal and this is 3, 4, 6, then 5, 1. 3, 4, 6 cranial nerve, 3, 4, 6 cranial nerve, and then 5, 1. Okay, so 3 oculomotor trochlear and abducens, and superior and inferior ophthalmic vein. But first we have frontal, lacrimal, nasociliary branches of the ophthalmic nerve. This is V1. In V1 we have these 3. V1, frontal, lacrimal and nasociliary division of the ophthalmic nerve, and superior and inferior division of the oculomotor nerve. Also superior and inferior ophthalmic vein and trochlear and abducens nerve. So by this way it will be easy. Superior and okay, frontal, lacrimal and nasociliary division of the ophthalmic nerve, superior and inferior division of the ophthalmic vein, superior and inferior division of the oculomotor nerve, and trochlear and abducens nerve. Then carotid canal, internal carotid artery, and some sympathetic plexus, and inferior petrosal sinus. No, only internal carotid artery, sympathetic plexus around internal carotid artery, and some emissary vein. Deep petrosal nerve, internal carotid artery, deep petrosal nerve. Okay. Deep petrosal nerve. Now jugular foramen. Foramen anterior, posterior, and intermediate. Anteriorly inferior petrosal sinus, posteriorly sigmoid sinus, which bind with inferior petrosal sinus to drain into sigmoid sinus, and intermediate glossopharyngeal vagus and accessory. GVA, guava, 9, 10, 11, in between. Anteriorly inferior petrosal sinus, posteriorly sigmoid sinus, and they both join together to drain into internal jugular vein, and in between 9, 10, 11, uh, glossopharyngeal vagus and accessory. Then stylomastoid foramen. We have stylomastoid artery. And facial nerve and vestibulocochlear nerve together. And then foramen magnum, we have foramen magnum. It is written nicely in this one. Foramen magnum, we have vessel, vertebral artery, anterior spinal artery, posterior artery, vertebral artery, anterior spinal artery, posterior spinal artery, anterior spinal artery 2, posterior spinal artery 1, total 3. Vertebral artery, anterior spinal artery, posterior spinal artery. Then nerve, we have spinal accessory nerve, lower end of the medulla, spinal accessory nerve, lower end of the medulla, and tissues. We have apical ligament of the dens, trochlear membrane and apical ligament of the dens. Here we need to see this picture little time with nicely. Okay, this is frontal bone, maxilla, palatine bone. Then the foramen ovale. This is foramen ovale. We know foramen ovale from the internal view, but outer side it is little difficult. This is foramen ovale, and it is in the sphenoid bone, I think, like butterfly shape. Foramen ovale, Then foramen lacerum. This is foramen lacerum, and this is carotid canal. So internal carotid artery enter through it, then go over the foramen lacerum, and after going there, then they give the branches. Temporal bone. This is temporal bone. Yes, temporal, frontal, parietal, temporal. Because external auditory meatus also the same here, and this is styloid process. Temporal bone. Foramen ovale. Foramen ovale is in the sphenoid bone. And this is carotid canal. Behind carotid canal, we have the jugular foramen. Jugular foramen. Yes, this is jugular foramen, and this is occipital condyle and foramen magnum. Occipital bone, inferior view. Now, internal view. We have here all the foramina and content. So first we have cerebriform plate of ethmoid. Here we have olfactory nerve in the anterior cranial fossa or the nasal cavity. Cerebriform plate of ethmoid. Here we have olfactory nerve. Then optic nerve. This is optic nerve in the optic canal. What are the content in the optic canal? We have optic nerve with 3 layer and ophthalmic artery. So it is also in the medial cranial fossa. Okay, medial cranial fossa boundary we have seen. Optic canal, medial cranial fossa, optic nerve, and ophthalmic artery, olfactory optic, then oculomotor. Oculomotor will come with superior orbital fissure. Just behind it, superior orbital fissure, oculomotor nerve. Just now we have read that superior and inferior division of the oculomotor nerve, then superior and inferior division of the ophthalmic vein, then frontal, lacrimal, and nasociliary division of the ophthalmic division of the trigeminal nerve, and trochlear and abducens nerve. These all will come through the superior orbital fissure. It is also in the medial cranial fossa orbit. So ophthalmic division, FLN, then oculomotor nerve, trochlear nerve, and abducens nerve. Superior ophthalmic vein, superior and inferior both. Olfactory, optic, oculomotor, then trochlear, abducens, finish, and trigeminal we got 1, that is V1, that is ophthalmic division. Then we have maxillary and mandibular division. Maxillary division will go through foramen rotundum. Maxillary will go through foramen rotundum. This is foramen rotundum, and there is a sequence ROS, rotundum ovale spinosum, ROS, rotundum ovale spinosum. Rotundum, this is foramen rotundum. This is also in the medial cranial fossa, and foramen rotundum, the medial cranial fossa, pterygopalatine fossa. It is called pterygopalatine fossa. Maxillary division of the trigeminal nerve. Then we have remaining 1. First we got the ophthalmic division through the superior orbital fissure, then maxillary division through the foramen rotundum, and mandibular division. Mandibular division will go V3. Mandibular means V3. It is a part of ovale. V is V3, and ALE. O is otic ganglion. First we have, what is otic ganglion? Foramen ovale, otic ganglion. V3, mandibular division of the trigeminal nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. So foramen ovale, mandibular division of the trigeminal nerve. Then trigeminal finish, oculomotor, and trochlear also finish. Then number 7. 7 is facial nerve. Sorry, yes, facial nerve and vestibulocochlear nerve. They will go through stylomastoid foramen. Uh, stylomastoid foramen, it should be from, this is foramen lacerum. Okay, foramen lacerum. Where is carotid canal? This is stylomastoid foramen for the facial nerve. Stylomastoid foramen will go behind the styloid process. See, behind the styloid process is stylomastoid foramen, through which facial nerve and vestibulocochlear nerve both. So we can finish this picture. So we have foramen rotundum, foramen ovale, and foramen spinosum. Through foramen spinosum, we have foramen spinosum. We have middle meningeal artery and meningeal branch of the mandibular nerve. Middle meningeal artery and meningeal branch of the mandibular nerve. Middle cranial fossa finish, and this is carotid canal. Carotid canal. Carotid canal not ready. Foramen rotundum, foramen ovale. Now carotid canal. Carotid canal, mainly internal carotid artery and middle cranial. Okay, internal carotid artery, internal carotid artery, internal carotid artery. Aha. See, through internal carotid artery will enter through here. Then it will go up and it will curve.
Cavernous.
Huh? Sorry.
So cavernous sinus.
Yeah, I was little confused about this. And yesterday I discussed with one of my professor. Then she said, internal carotid artery, when we see in the cavernous sinus, we know internal carotid artery 1, but in cavernous sinus sometimes it looks like 2 division, but we know internal carotid artery they don't give any division, but it is because of the loop. When they enter through the carotid canal, they go up and then they loop, make like a S shape, and then they come back. That's why at this level, if we see, we will see 2 branch, but it is because of their looping. So this is internal carotid artery in the carotid canal, and they go over the foramen lacerum, but they don't give any branch. Okay. Then foramen spinosum, then medial cranial fossa finish. Foramen lacerum filled with cartilage in life. Filled with cartilages in life. Okay. This is foramen lacerum. Ultimately, foramen lacerum does not transmit or contain anything. They are filled with cartilage in life. Okay. Then posterior cranial fossa. Posterior cranial fossa. First we have internal acoustic meatus. Okay, this is internal acoustic meatus. Internal acoustic meatus. It will transmit internal acoustic meatus. It will transmit facial nerve with vestibulocochlear nerve and labyrinthine artery and vein. This is important. Internal acoustic meatus transmit internal acoustic meatus transmit facial nerve and vestibulocochlear nerve, along with they have labyrinthine artery and vein. Posterior cranial fossa, ear and neck via stylomastoid foramen, internal acoustic meatus, facial nerve, vestibulocochlear nerve, labyrinthine artery and vein. Next to it, we have a big jugular foramen. It has 3 parts: anterior, posterior, and intermediate. Anteriorly, we have inferior petrosal sinus. This is inferior petrosal sinus, which will come from the sigmoid cavernous sinus, and this is the superior border of the petrous part of the temporal. Here will be the superior petrosal sinus. So inferior petrosal sinus will come as like in the anterior. So anteriorly will be inferior petrosal sinus, posteriorly sigmoid sinus, here sigmoid sinus, and sigmoid sinus with inferior petrosal sinus, they will join together to drain into internal jugular vein, and in between will be three nerve, G, V, A, glossopharyngeal, vagus, and accessory. So anteriorly inferior petrosal sinus, posteriorly sigmoid sinus, and in between glossopharyngeal, vagus, and accessory nerve. Then we go little down, we will get hypoglossal canal. Hypoglossal canal just lateral to the foramen magnum. Hypoglossal canal will transmit hypoglossal nerve, posterior cranial fossa, hypoglossal nerve, which giving pure motor supply in the tongue muscle except palatoglossus. Okay, and then foramen magnum. Foramen magnum, it has vessel like vertebral artery, anterior spinal artery, posterior spinal artery, then nerve, spinal accessory nerve, pons, and the medulla, lower part of the pons, and medulla oblongata, and and no vein actually. I think no vein, right? Vessel, vertebral artery, anterior spinal artery, posterior spinal, but no vein. Spinal root of the accessory and lower end of the medulla, and tissue apical ligament of the dens. Apical ligament of the dens. Then what we have? Then now inferior view. This is very difficult one. Foramen ovale. This is foramen ovale. Foramen ovale. Foramen ovale, we know the content. Foramen ovale. Foramen ovale. Okay, foramen ovale. Foramen ovale, and this is, I think, that foramen ovale. This is jugular foramen. Foramen ovale. Then behind it, foramen spinosum. Carotid canal. Carotid canal. Carotid canal. Carotid canal. Carotid canal. Then will be the jugular carotid. This is carotid canal, and from here I think it goes like this. Carotid canal like this. No, carotid canal. Carotid will go inside. After going inside, it will loop. And this is jugular foramen hypoglossal canal. This is hypoglossal canal. Hypoglossal will exit through it, and it will come through this hypoglossal. Stylomastoid foramen, just before the styloid process, behind foramen magnum. Okay, this picture. Yes, Esra, again you can start. One. Where is one? One is anterior clinoid process. Your voice is very less. 4 is clavus. 8 is dorsum silla. 11 foramen magnum. 12 foramen ovale. 13 foramen rotundum. 14 is foramen spinosum. 15 15 is frontal crest. 23 23 is that transverse?
Group 4 transverse sinus.
Group 4 transverse sinus. Okay, 23 group 4 transverse sinus.
Yeah. 27.
27 is hypoglossal canal. Hypoglossal canal. 27 hypoglossal canal.
Oh, yes. 28.
28 internal acoustic meatus.
Yes. 29.
29 internal occipital protuberance.
Okay. 30.
30 is jugular foramen. 30 is jugular foramen.
32.
32 laser wing of the sphenoid.
Wait. Okay. 34.
34 this is optic canal.
74. Okay.
Asma, you are there? Asma,
Yes.
are you there?
Yes, I'm here.
You can also answer.
37.
37 petrous part of the temporal bone.
38.
38
Pituitary.
Yeah.
38 is pituitary fossa. Okay.
31.
31 what is 31?
It's above the pituitary fossa, about 40.
31 31 is what?
32.
What is 31?
No, 31 not important. 32.
32 already said, I think, before.
Yes.
Where is 32? 32 laser wing of the sphenoid.
Okay. 42.
42 superior orbital fissure.
41.
41 squamous part of the temporal bone.
43.
43 tegment tympani. 43 and 41, this is difficult. 41 is squamous part of the temporal bone and 43 tegment tympani. Okay.
44.
44 is 44 trigeminal impression. I don't know. 44 Trigeminal impression.
Okay, done.
Here I'm
Three.
off. Which one?
7.
3. 3 is here. Carotid canal. I'm afraid of this picture. Carotid canal.
And
Carotid canal.
6.
3 is carotid canal. 6. And I studied also very less. Maybe last 3 months I didn't read. Carotid canal. Where is 6? 6 is external acoustic meatus. External acoustic meatus. Here it would be here. But external acoustic meatus we have seen just behind the styloid process. Okay.
9.
Oh, this is styloid process. Okay. This is styloid process. So behind it, 47 actually should be. No. What I'm saying.
9.
Two are different.
9 foramen lacerum.
9 foramen lacerum. Okay. 9 foramen lacerum. 10 foramen magnum.
11.
11 is foramen ovale. But
12.
wait, please give some second to digest. Foramen ovale. Foramen ovale. Foramen ovale. Foramen ovale. Then
12.
12 is foramen spinosum. ROS. RO and S.
Rotundum is not appearing here.
Rotundum will not come here in this view. No. Okay.
Yeah.
So
Rotundum means dark, and dark because of it is covered from down, cannot appear.
okay.
15.
15 is a hypoglossal canal. 15 is hypoglossal canal. Okay. 15 hypoglossal
17.
canal. 15, then 17. Where is 17 is
17.
Yes. 17 is inferior nuchal line. Nuchal line.
Yeah.
8, I
Yes.
think 8 is superior nuchal line. Should be. No. 8 is occipital protuberance. 48 should be superior nuchal line. 48
Yes.
superior nuchal line, and that's why 17 is inferior nuchal line. Okay.
20.
20
Regular.
is jugular foramen. Jugular foramen. Jugular foramen. How we will remember this? Jugular foramen. Jugular foramen. Jugular foramen. Okay. Then
I will remember. Okay. 23.
23. 23. 23. Okay. Mandibular fossa. 23 mandibular fossa. Okay.
46.
Stylosis.
Number 5 is
Yes.
styloid. 46. 46 is styloid process.
47.
It is stylomastid foramen.
Done.
One second, again we can see from here What is 16?
16.
Incisive fossa. Incisive fossa. Then what is 53? The zygomatic arch, maybe. 53.
53.
Zygomatic arch. Then come to this 37. Posterior border of the vomer. Okay, not important. Then come first foramen, ovally, next to it foramen rotundum, then little medially.
Not foramen spinosum.
Because it is spinosum, not rotundum.
Spinosum. Foramen ovally, then foramen spinosum. Okay. Then carotid canal. Number 3 is carotid canal. Here also this is carotid canal, and here this fossa is mandibular fossa. Mandibular fossa. This is carotid canal. Carotid canal. Carotid canal. And behind carotid canal there is like foramen. This is jugular foramen, because from here internal jugular vein and carotid, they will remain side by side.